would be...
Do some states cheat?
Yes.
Okay.
Many states cheat with enforcing.
Do all states follow the federal rules?
No, they don't.
Some of them cheat, don't they?
Many of them cheat, Senator, and estimated that it's $33 billion. It was $33 billion in 2024.
Has anybody gone to jail for doing this?
Not to my knowledge.
Don't you think we ought to put people in jail for cheating?
Senator, I do not believe states are cheating.
Cheating? What planet did you just parachute in from? Cheating.
I do not believe states are
Do
cheating.
you believe in the tooth fairy?
Billions of taxpayer dollars, allegations of Medicaid fraud, and one answer Senator John Kennedy simply refused to accept. The confrontation that followed quickly became the hearing's most talked about moment.
Before President Obama expanded Medicaid to include able-bodied working adults, traditional Medicaid covered the poor, pregnant women, people with disabilities. Is that correct?
That's correct, Senator.
And today those people are still covered, are they not?
Correct.
And is it not the case that for those folks in traditional Medicaid, for every $1 that, this is an average, for every $1 that a state puts up, the federal government puts up $1.33. Does that sound about right?
That's average across the country, Senator.
All right, now President Obama, through Obamacare, extended Medicaid to able-bodied working adults. Is that correct?
Correct.
And on average, the federal government for those, I'll call them Obamacare, Medicaid, expansion enrollees, for every $1 that the state puts up, the federal government puts up $9. Is that correct?
That's correct.
Okay. So if you're a governor for traditional Medicaid, you can get $1.33. For Obamacare expansion enrollees, you can get $9.
That's the math that they face.
Right. Now, if you're a governor, you're going to try to get as many people on Medicaid through Obamacare expansion, are you not?
That is the incentive that states have, Senator, yes.
Do some governors cheat?
There are definitely some states that have a massive problem of improper enrollment. So people who would be...
Do some states cheat?
Yes.
Okay.
Many states cheat.
Now, the states determine, in accordance with federal rules, who's eligible for Medicare. Is that for Medicaid? Is that the case?
Yes.
Okay. Now they have to do it in compliance with federal rules, right?
There's the federal eligibility rules that the federal government does a very poor job of enforcing.
Do all states follow the federal rules?
No, they don't.
Some of them cheat, don't they?
Many of them cheat.
Right. Do some states just accept people's word that they make a certain amount of money and therefore qualify for Medicaid?
Yes, Senator.
Do all states say, listen, we hear you and we're not saying you're lying, but we're going to cross-check your application with our state income tax records? Do all states do that?
Not all states do that.
Okay. If they did, they would find out that some people are lying, wouldn't they?
They would.
Now, what's your best guess as to how much per year this cheating costs the federal taxpayer?
We released the report on this yesterday, Senator, and estimated that it's $33 billion. It was $33 billion in 2024.
Okay. And that's $33 billion that is taken away from the people who really need Medicaid. Is that right?
Yes.
Okay. Has anybody gone to jail for doing this?
Current federal policy continues to distinguish between administrative eligibility errors, improper payments, and intentional fraud, with oversight agencies emphasizing that not every improper payment is the result of criminal misconduct.
Not to my knowledge.
Don't you think we ought to start putting people in jail for cheating?
I think that it's financial fraud against the federal government, yes.
Sir, on the end, I'm sorry, I can't read your name. Sir, I'm sorry. Don't you think we ought to put people in jail for cheating?
Senator, I do not believe states are cheating.
You don't believe they're
I do
cheating?
not believe
All
that.
right. If they were cheating, what planet did you just parachute in from? Sir?
Sir,
You don't
I've worked
believe
on
states
this.
are
I've
cheating?
worked on this program for a long time.
But I'm be sure
it's
I
not
understand.
perfect,
You don't
but
believe
states do not
You don't
cheat.
believe states are cheating?
I do not believe states are
Do
cheating.
you believe in the tooth fairy? Sir? Do you believe in the Easter Bunny? Do you believe that Jimmy Hoffa died of natural causes? You're not answering.
I do not believe states are cheating in their administration of the Medicaid program.
Okay. I'm glad you have some water in front of you because your pants are on fire. I'm going to go back to Dr. Blaze. Tell me in the 13 seconds I have left, other than putting these people in jail, both the people who cheat and the bureaucrats who allow them to cheat, how else you would fix Medicaid?
So the key problem with Medicaid is that the more states spend, the more money they get from the federal government. So to set the certain amount that states get, and all state spending on top of that comes from the state, that would be an ideal reform. But I'd say a first order reform is to end the discrimination against the most vulnerable. There shouldn't be the federal government incentivizing states with 7 times more money for the able-bodied than traditional enrollees.
Sir, to the gentleman on the end, I don't mean to be rude to you, but if you really believe there's no cheating, you need to put down the bong. That's one of the most extraordinary statements I've ever heard a witness make.
Since this August 4th, 2026 Senate Budget Committee hearing, the Trump administration has continued making Medicaid program integrity one of its highest domestic policy priorities. In the weeks following the hearing, the Department of Health and Human Services, HHS, and the Centers for Medicare and Medicaid Services, CMS, announced additional oversight measures aimed at identifying improper Medicaid payments and strengthening eligibility verification. On July 21, 2026, HHS confirmed it was deferring more than $1 billion in federal Medicaid payments to California and Minnesota while conducting reviews of claims the administration said required additional documentation before federal reimbursement could proceed. Federal officials stressed that the action was a temporary payment deferral rather than a permanent funding cut, and stated that both states would have an opportunity to demonstrate compliance with federal Medicaid requirements before any final determination was made. The administration described the review as part of a broader campaign to reduce fraud, waste, and abuse within the Medicaid program while ensuring taxpayer dollars are spent only on eligible beneficiaries. The broader policy changes discussed during the hearing have also continued to move forward. Earlier in 2026, Congress approved major Medicaid reforms through the Working Families Tax Cuts Act, requiring more frequent eligibility verification, work requirements for many able-bodied adult beneficiaries, stronger identity verification procedures, and expanded data matching between federal and state agencies. CMS has since proposed additional regulations designed to close financing loopholes and strengthen oversight of state Medicaid payment practices, arguing that the changes could save taxpayers billions of dollars over the coming decade by reducing improper federal reimbursements. At the same time, several governors and healthcare organizations have warned that stricter verification requirements could increase administrative burdens and potentially delay healthcare coverage for some eligible beneficiaries, setting the stage for continued legal and political disputes over how aggressively Medicaid eligibility should be enforced. Congress has likewise continued examining Medicaid spending through additional oversight hearings held after this exchange. Republican lawmakers have pointed to federal audits estimating tens of billions of dollars in annual improper Medicaid payments as evidence that stronger safeguards are necessary, while Democratic members have argued that improper payments do not necessarily represent intentional fraud and that many result from paperwork errors, delayed documentation, or administrative complexity rather than deliberate abuse. That distinction has remained one of the central disagreements in the broader healthcare debate. Federal inspectors general have also continued recommending improvements in eligibility verification, income matching, and oversight of state Medicaid programs, while emphasizing that both the federal government and state governments share responsibility for protecting program integrity. The hearing itself highlighted one of the most significant policy disagreements surrounding Medicaid financing since the Affordable Care Act expanded eligibility in 2014. Senator John Kennedy focused on the different federal reimbursement rates between traditional Medicaid populations, including children, pregnant women, seniors, and people with disabilities, and adults covered through the Affordable Care Act's Medicaid expansion. He argued that because the federal government contributes a substantially higher share of funding for expansion populations, states have a financial incentive to prioritize those enrollees over traditional beneficiaries. Dr. Brian Blase largely agreed with Kennedy's assessment. He explained that the enhanced federal matching rate creates incentives for states to maximize enrollment under the Medicaid expansion population because the federal government pays a significantly larger portion of those costs. Blase cited research estimating that improper enrollment and eligibility problems resulted in approximately $33 billion in federal spending during 2024. Based on that analysis, he argued that stronger verification procedures, greater state accountability, and reforms to Medicaid's financing structure would reduce improper payments while preserving resources for individuals the program was originally designed to serve. The most contentious exchange came when Andy Schneider challenged Kennedy's repeated use of the word cheating. Schneider argued that although improper payments and administrative errors certainly occur, he did not believe states were intentionally violating federal law or engaging in widespread fraud. Kennedy strongly rejected that distinction, insisting that repeated failures to verify eligibility and enforce federal rules effectively amounted to cheating taxpayers regardless of whether state officials intended to violate the law. The exchange quickly became one of the hearing's most memorable moments as Kennedy used a series of rhetorical questions to challenge Schneider's position before returning to Blase for policy recommendations. At the center of the disagreement was an important legal distinction that often gets lost in public debate. Improper payments are not automatically the same as fraud. Federal agencies define improper payments broadly to include payments made in the wrong amount, payments lacking sufficient documentation, administrative processing errors, or payments made to individuals later determined to be ineligible. Criminal fraud, by contrast, generally requires proof that someone knowingly and intentionally deceived the government for financial gain. Republicans have argued that many improper payments ultimately stem from weak eligibility controls that invite abuse, while Democrats caution that describing every payment error as fraud risks overstating the problem and undermining confidence in a program serving millions of eligible Americans. The hearing also underscored the complicated partnership between the federal government and the states. Medicaid is jointly funded and jointly administered, meaning states determine eligibility and operate their programs within broad federal rules while the federal government reimburses much of the cost. That arrangement has long produced disagreements over accountability because federal officials establish program requirements, but state agencies conduct much of the day-to-day administration. When errors occur, questions inevitably arise over whether responsibility lies with state implementation, federal oversight, or the complexity of the program itself. Another issue raised indirectly during the hearing involves the financial incentives embedded within Medicaid's current funding formula. Under the traditional matching system, the federal government pays a percentage of each state's Medicaid costs that varies according to state income levels. The Affordable Care Act created a much higher federal matching rate for newly eligible expansion populations, a policy intended to encourage states to broaden health care coverage. Supporters argue that the enhanced funding successfully expanded insurance coverage to millions of low-income adults who previously lacked access to affordable health care. Critics counter that maintaining two different reimbursement formulas encourages states to focus resources where federal reimbursement is greatest rather than where medical need is highest. That disagreement continues to shape proposals for broader Medicaid reform. The discussion also reflected larger concerns about the federal budget. Medicaid remains one of the federal government's largest mandatory spending programs, and rising health care costs, an aging population, and growing enrollment have increased pressure on lawmakers to balance fiscal responsibility with maintaining health care access. Supporters of stronger anti-fraud measures argue that reducing improper payments can preserve the program for future generations without reducing benefits for eligible recipients. Others caution that aggressive enforcement must be carefully designed to avoid mistakenly removing qualified beneficiaries or creating barriers that prevent vulnerable individuals from receiving care. Looking back, this hearing represented more than a debate over a single audit or reimbursement formula. It reflected two fundamentally different approaches to governing one of America's largest public health care programs. One side argued that protecting taxpayers requires stronger verification, tighter oversight, and greater accountability for states administering Medicaid. The other emphasized that administrative complexity should not be confused with intentional fraud and warned that overly aggressive enforcement could unintentionally restrict access for eligible families. As Congress continues debating the future of Medicaid, federal spending, and health care reform, the issues raised during this hearing remain at the center of the national conversation about how to balance program integrity, fiscal responsibility, and access to care for millions of Americans.